So let's move on a little bit here to kind of dissecting what's going on with ulcers or GERD. Trying to distinguish first of all the symptoms, and then we'll talk about the pathology a little bit, the pathogenesis of each of these. So ulcer symptoms in general, one of the key points here is a burning sensation in the abdomen, and it's usually 2 to 3 hours after a meal. That's typically when the acid secretion is going to be the highest, but also sometimes at night. There is pain relief when you eat or drink, and actually drinking water does dilute the acid some. Antacids, H2 antagonists, or PPIs can relieve some of the pain. That pain is probably acid destruction of the stomach epithelial tissue. So it's actually pain and inflammatory signals going on at the same time. Blood in the stool can occur, but since it's so high up, it's usually not detectable. It's usually occult. You need a guaiac test to detect that. GERD, gastro and esophageal reflux disease, has some distinguishing symptoms from ulcers. So we'll get to the basics of GERD coming up, but again, it's basically reflux up the esophagus, and these are the main distinguishing symptoms, as opposed to the burning sensation in the abdomen, tasting acid or food in the back of the mouth, a dry cough with this, trouble swallowing, or asthma symptoms, as we'll get to, are some of the typical kind of symptoms typically see, and then increased heartburn. And this heartburn can manifest anything from, it's called heartburn because the pain is rather diffuse, and it can actually feel a little bit like a heart attack pain, even though it typically isn't, or it can be lower in the abdomen too. It's associated with eating a particular food, sometimes with a particular food, usually about 30 minutes to 2 hours after the eating. And the pain is typically worse when the person lies down and bends over. So those are some of the symptoms of GERD that can distinguish it from an ulcer, whereas for ulcers, lying down doesn't necessarily make the symptoms worse. In fact, it might make it a little better depending on where in the if it's the antrum of the stomach, where the particular damage is. So let's get back to the basics here. We're going to first start off with ulcers and go through some of the medications and alternative methods that are used for this. So what's an ulcer? It's essentially a hole in the epithelial layer of the stomach or the duodenum, and it's actually there are more of them in the duodenum, as we'll see. Most ulcers occur in the duodenum. And key point here is that it goes through the epithelial layer, through the smooth muscle, and into the submucosa. So here's a picture of a discrete ulcer in a duodenal bulb, and I like this picture because it shows the ulcer here, the cavity going through. Note that there's a mucus layer initially, and in the mucosa, note the crypts, and then all the way through the smooth muscle layer and into the submucosal layer is where we have damage all the way down here. So that's classically an ulcer, and we'll get back to this in a minute. So all the way through, note that there's mucus, through the mucosal layer here, through the smooth muscle layer, into the submucosa, by definition for an ulcer, and then that doesn't heal correctly. So let's go back. So a couple of definitions. Peptic ulcers can occur in the stomach or duodenum. A gastric ulcer is in the stomach, and a duodenal ulcer is in the duodenum. Most ulcers are actually in the duodenum, more than in the stomach. So that's a key point to keep in mind. The conditions in the duodenum are somewhat different. The pH is somewhat different. The flow of chyme out is critical. So just keep those factors in mind when we're talking about some of the differences here. And so one of the big questions then is what causes ulcers, and there's quite a bit of research on this, and our understanding has really changed a lot over time. And I list the major causes of ulcers as first NSAIDs and then H. pylori. A lot of other places list H. pylori first, but in fact the data and the new data is changing. The rate of H. pylori infection is going way down, and the amount of ulcers is not decreasing by